I'd like to begin the conversation by setting up the big problem that we face in COVID-19 when it comes to protecting a person, particularly a person such as a healthcare worker who often comes in contact with many patients of COVID-19. The big challenge in a disease like this is, in addition to being a highly infectious disease, COVID-19 can be transmitted by airborne methods, by airborne droplets specifically. And so whenever any one of us talks, sneezes, coughs, sings, or yells, we always emit from our mouths a variety of aerosol droplets. In the case of COVID-19 patients, those would contain live virus. And the droplets that are large, so more than 5 microns in size, generally settle out of the air onto surfaces, in which case you would want your sanitizing wipes and all of that. But it's the droplets that are smaller than 5 microns. And to give you an idea of what 5 microns is, a human hair is 60 microns. So 5 microns is about the 10th the size of a hair. Those are invisible to the naked eye, and they hang around in the air for extended periods of time. And it can sometimes even be the case that the viruses in those droplets, the water around them starts to evaporate, and at some point you just have one or maybe a few viruses hanging around in a droplet that's much smaller than 5 microns in size. So the COVID-19 SARS-CoV virus is approximately 100 nanometers in size, and as a standard of comparison, that's 1,000 times smaller than a typical human hair. And so one of the challenges in personal protection, in providing protection for healthcare workers, specifically against being infected by COVID-19, is how do we protect them from exposure from droplets or viruses that are in air that is so small. Next slide, please. And one of the key pieces of personal protective equipment that is needed are these masks. They're called N95 face masks or N95 respirator masks. These masks are rated to block out 95% of all particles in the air from reaching, in this case, the person's mouth. And for healthcare workers, this is a very critical piece of personal protective equipment. And how these masks work is that they contain within them, if you actually cut one open, you'll see there's a couple layers of what looks like fabric. And usually the middle layer or the middle 2 layers will have the filter layer. That would be the active filter material. And what these filters look like is, I have a large electron microscope image here in they look like a bunch of spaghetti fibers all tangled upon each other. But these filters are made of polypropylene, which is a plastic, but very, very small polypropylene fibers that are it's a non-woven material, so it's melt blown, so it's not like your typical fabric. And these fibers are so small and so densely organized upon each other that they're able to provide a filtration ability against even something as small as a virus particle. So that is one method that these masks work. Now, on top of this physical barrier to viruses going through the mask, there's an additional challenge, which is that when you have a filter that's so dense, you start running into the problem where you're actually decreasing the air permeability through the mask. And that's why, actually, if any of you have ever worn an N95 mask, it's not the easiest thing to breathe through. But considering it's blocking out 95% of all particles, it's actually engineering accomplishment that we can breathe through them. And one of the technologies that enables air to pass through relatively easy through one of these filters is that on the surface of these very small filters, there is an electrostatic charge called an electric charge. And these actually help improve the ability of the filters to capture particles, including particles, but maintain breathability through the mask. Now, where this brings a challenge to our current COVID-19 pandemic is, if we go to the next slide, please, Jen, is that these masks, because of the way this fiber technology has been developed, they have no inherent ability to kill viruses. They simply act as a trap, but you still have live virus trapped within this mask. And because of the particular technologies, this electrostatic charge and the small polypropylene fibers, they really can't be disinfected with your typical solution-based disinfecting technologies such as waving or dunking in alcohol or dunking in bleach. And the way they're developed this technology is they're intended for single use only, which means that the doctor or the nurse should discard their mask after they see every patient to avoid taking that contaminated mask to be in contact with the next patient or in contact with somebody else. And what that set us up for as a society is a shortage of these N95 masks, which is a problem. It was a very, very large problem back in April. It's still quite a significant problem now. And so the solution that we propose in this project that we're working on is to develop a way to coat the filters of these masks with a polymer that is actively able to kill viruses on contact. And in this way, this will allow these masks to be worn for more extended periods of time without having to discard them in between each patient, as well as allow them to be potentially disinfected and reused without worrying about decreasing filtration efficiency. And at this point, I'm going to turn it over to Ed, my co-investigator on this project, to describe our project in further detail.
Okay, thanks, Helen, and good afternoon, everyone. Thanks for joining us. So on the next slide, I'll talk briefly about how we're thinking about approaching this problem. And in fact, we are currently making some great progress. So we want to take a material that we know is antimicrobial. So it can kill a broad spectrum of bacteria, and it can deactivate enveloped viruses such as SARS-CoV-2. Now, such materials are already known. I've worked in the field of antimicrobial polymers for about a decade now. And so we have lots of formulations that we know can kill microorganisms. The problem, though, as Helen pointed out, these masks are porous materials made of very tiny fibers. And so we want to coat the surface of every one of those tiny little fibers with a really, really thin but dense layer of antimicrobial polymer. And so you can imagine this is an engineering challenge, because if I put too much polymer down, I can clog the pores, and then you won't be able to breathe easily through the mask. So it's already difficult to breathe through an N95. And so we want the minimum amount of really ultra thin coating on the surface of these fibers to get really potent antiviral activity. If we're able to accomplish that, which experiments are currently underway, what that would mean is that when the virus, when aerosols contact the mask material, not only is the virus trapped or filtered, it also gets directly killed. So this mask would be inherently self-sterilizing. So the way we're approaching this is by a solution-based coating process. We submerge the material in a solution containing the antimicrobial polymer. You have to really precisely control the conditions. So the type of solvent, the temperature, the time, the concentration. And if you get it just right, you can form this kind of thin conformal layer that we're aiming towards. And so we've had some success in recent weeks, and hopefully we'll have a prototype fairly soon, I think. So then on the next slide, we just want to mention how this works. So basically, the polymers that I work with they have a positive charge. And so that enables an attraction with the negatively charged outer envelope of the virus. And these polymers also contain some hydrophobic groups, so they don't like to be in water. The lipid envelope is also hydrophobic. And so much like a soap molecule can disrupt membranes, these hydrophobic and cationic polymer surfaces are also putatively able to strip away that outer envelope on the virus. And that eliminates the ability of the virus to infect the human cell. So it's essentially, you can think of it as being dead. Another approach with a different kind of polymer stuck on the surface would be this multivalent binding interaction, where we grab a hold of those spike proteins and we don't let the material go. And so once this happens, once again, the virus would be unable to infect a human cell. So we look forward to answering any questions that the audience might have. And we, of course, want to thank our sponsors and some companies that helped us out. Well, the materials were supplied by this company, Hills Inc. Our collaborators at Mount Sinai will be testing our prototype against actual clinical isolates of the SARS-CoV-2 virus once we finish our work here on campus. And thank you to the NSF for funding.